new study suggests new target for testing COVID severity. SARS-CoV-2 can be detected using lab methods such as RT-PCR and antibody tests. The former is the gold standard to date, and the latter is quicker but isn't as accurate as the other. Recently, a study questioned the reliability of popular COVID tests in catching those who are sick. Researchers suggested using a new marker for asymptomatic cases. But before we continue, please like this video if you find this informative and subscribe to our channel for more interesting and informative content. Don't forget to click the bell icon too to get the latest updates. Led by the Skolkovo Institute of Science and Technology, or Skoltech, researchers and collaborators examined the immune response to COVID-19 in patients with different levels of disease severity. Using antibodies, they discovered a disparity where some patients without symptoms were lacking an antibody type. That antibody is the target of certain popular testing kits. A little background first. Tests that don't track the virus itself often target antibodies, specifically IgG. If IgG is high in a person experiencing COVID-like symptoms, doctors may request further tests. Unfortunately, this antibody doesn't give straightforward details. Its presence in the blood varies depending on which of the virus part it attaches to. IgG could target the nucleocapsid protein or the receptor binding domain of the virus. This is where it gets tricky. Although both antibodies could be produced by the body, most tests only check those that target the RBD. First author Maria Tutukina explained that asymptomatic COVID patients usually lack IgG antibodies for this protein. Around 50% of patients they examined had no significant antibodies targeted by those tests. With this big difference, how could those popular testing kits track down asymptomatic patients? They proposed to make that antibody type a marker for testing kits. We should have access to kits that can detect anti-RBD antibodies and antibodies for the nucleocapsid protein. This is a reasonable idea when managing outbreaks. It can help tracers to find those who may have been exposed to the coronavirus but are not experiencing symptoms. Remember, some people don't feel anything because their immune system is just so good at handling the virus. What do you think of the proposed marker? Would different antibody testing kits cut down the spread of coronavirus? Share your thoughts in the comment section. Till our next video, thanks for watching.